Given this situation, we must ensure all the infected are admitted and treated. At the same time, we must provide services to the general public to meet their regular health needs. That's why when we allocate health resources, we've always been taking well-coordinated measures to balance and meet the needs of the COVID-19 patients and the general public. In accordance with the ninth version of the diagnosis and treatment protocol, the COVID-19 patients are classified for triaged treatment. The mild cases and asymptomatic infections are admitted into camping hospitals, while the moderate to severe cases are admitted into the designated hospitals. With such a classification, the camping hospitals will serve to accommodate the needs of the mild cases and asymptomatic cases, while the routine health needs of the general public will not be compromised or overstretched. We've also issued management standards for administrating over camping hospitals. Localities must combine the emergency needs and normal needs. Localities are requested to tap into existing stadiums or exhibition centers. For such large-scale indoor places, localities can refurbish these existing facilities and get them prepared to be transformed into camping hospitals in case of emergency needs. During the normal time, these exhibition centers and stadiums keep their original functions. Second, infrastructure, supply, and personnel preparation must be in place. For example, in the refurbishment of these large-scale indoor places, electricity, water supply, toilets, bathroom, showering, and ventilation infrastructure must be in place. The bed sheets, medical supplies, medical equipment, and medical information system should also be prepared. Most importantly, the health workforce must be ready for the response of any cluster case. Third, in the actual management, the management system should be owned by the local government, and the designated hospitals will be paired up with the camping hospital. We must ensure that the camping hospitals are safe and can provide well-coordinated and comprehensive and safe services to the infected.
So the necessity will be met as well, so that we should do everything we can to guarantee the administration and the normal operation functioning of the camping hospitals. The journalist once mentioned just now, some of those camping hospitals do not have the optimum facilities and environment. That shows that the different regions rush to build those camping hospitals. In preventing the pandemic without thorough preparations in that regard, we have already issued the documents and instructions ordering different localities and regions to make preparations first, to make the relevant preparations in terms of infrastructure facilities in case there's a need of building hospitals, as well as the staff preparations, the healthcare providers' preparation, so that when there is a need, those hospitals will be put into operation, first thing, when there's necessary. Therefore, all those, infected will be quarantined. Also, other normal healthcare service will be provided. So the next question. So on the first row, I'm from, again, CCTV Financial Center. So what is the current situation of the pandemic across the country will be the major regions for the high level of new cases for this wave of pandemic? Have there been targeted to-the-point measures being adopted to prevent the spread of the pandemic going forward? How to instruct different provinces, localities to pull down this wave of pandemic? So, Ms. Hu Xiang, please answer this question. Well, thank you for the question. The pandemic situation in China is still quite severe and very complex. There has been acceleration of spread in certain regions. The difficulty for prevention is being increased. We have the following features of the pandemic. Firstly, we have increasingly new cases of newly infected. Since November the 1st, there has been 253,000 new cases reported across the country. We have 22,000 new cases on average over the past 1 week, roughly double the number for previous week. The second feature is that there has been a wider spread, and the chain of infection has been increasingly more complex. In some provinces, we have a sustained outbreak of the cases, and we have infection in multiple provinces. Therefore, in certain provinces, what is going on is the most complex, most difficult situation over the past 3 years. Well, third feature is that we have the outbreak in densely populated regions and cities, for example, like Guangzhou and Chongqing. These are very large cities, large population. Because of the large size population, as well as high mobility of the personnel, as well as the concentration of the personnel people in places like campus, the difficulties of preventing control has been double and increased because of the features of Omicron variant, as well as the stronger spread. And infection has been increasingly more difficult to identify the infected as early as possible, as well as difficulty of contact tracing. Therefore, there has been a constraint of resources and shortage of resources in preventing the pandemic control, as well as doing the quarantine, as well as providing relevant health care services. Against that context, we at the National Health Commission, as well as the National Disease Control Bureau, has sent our task force and instructing different regions to put into place the 20 optimized measures, provide on-spot guidance going forward. We'll stand by our measures of putting people's life first, and implementing the strategy of preventing the import of cases from outside China, as well as the rebounding of the domestic infection, so that the dynamic zero-COVID policy will be firmly implemented and stand by the NAN's prevention plan, as well as the implementation of the 20 optimization measures. So again, we will stay committed to that, taking even more aggressive measures to stop the pandemic control. Here, I want to remind you that it is a respiratory disease. Therefore, infection can happen very fast. Therefore, in our daily life, we need to abide by the basic rules. We need to wash our hands as frequently as possible. We need to do social distancing as for disinfection, so that you should be responsible for your own health, ultimately. So next question, please. So, the journalist to the left, the first row. Thank you, Mr. Moderator. I'm from China Daily. In the 20 measures, the media risk category should be removed in high-risk area. If there is no new case for high risk, then it should be lowered to lower risk. Why 5 days? What is the basis for the lowering the high risk to low risk in 5 days? Also, some citizens have to question what would be the definition of low risk. Is there any special reason, according to the situation of the pandemic, or any regions outside high risk should be identified as low risk? Those living in the low risk, how should they conduct self-protection? Ms. Wang Liping, your turn. Thank you for the question. In any high risk region, if there's no new cases for 5 days, then they should be lower to low risk. The reason why we have made this adjustment is based on the data as well as the evaluation for the NAN's version of prevention control scheme, which means that for the positive cases as well as close contacts can be quarantined or transferred to the Harbin hospital. For those under the control in the high-risk localities or regions, there's no new infection for 5 days in a row. That means the community spread has been basically stopped. Basically, there's no community spread in that particular high-risk, quote-unquote, high-risk region. Therefore, in order to reduce the number of personnel under restrict and control, in the 20 measures, the previous 7-day quarantine has been lowered to 5 days, so as to better coordinate the economic development and pandemic control. The so-called high-risk region, the other regions outside the high-risk regions in a particular county, including the municipality, city, should be identified as low-risk region. Therefore, in these regions, the residents should be committed to the individual self-protection and avoid the cluster. And they should reduce the frequency of going out. So for the people in this region, if they identify any symptoms of having fever or coughing or fatigue or sore throat, or the reduction or as well as conjunctivitis or the myalgia or diarrhea, also called major 10 symptoms, then they should go to the hospital as soon as possible. Also, we encourage the residents refrain from leaving the particular district. To the extent they want to leave, they must provide the negative COVID test result within the past 48 hours before they can leave the city. So the journalist to the right part, second row, please. Thank you, Ms. Moderator. I'm from New Beijing newspaper. We noticed that there are some netizens who are complaining that they visited several hospitals, but the high fever clinic have been suspended. They didn't know that before. So my question is, how can we solve that problem to guarantee the normal healthcare needs of the patients? So Ms. Guo Yinghong, please take this question. Thank this question. For the clinic for high fever symptoms, they should be operational 24/7. That's very important because one of the most important functions of such clinic is to identify the patients, whether they have been infected by COVID. Therefore, they should remain open as much as possible. That is crucial. For that matter, we have issued multiple instructions and documents instructing different localities to making sure all Tier 2 hospitals should set up their high fever clinics. Also, they should make available the address as well as telephone information to the public as much as possible so that the people know once they have some suspicious symptom, they know where to go so that they can be diagnosed to receive the necessary treatment. Also, we require that those clinics must implement this responsibility system of the first diagnosis. Once they identify patients which might be infected, then they should transfer that particular patient to the designated hospitals or the cabin hospital as early as possible so that the full release can be achieved. This means that all cases should be identified, discovered as soon as possible, should be treated as early as possible, should be reported as early as possible, and should be diagnosed as early as possible. In the region where there is a pandemic, we require all the healthcare facilities to do the very precise pandemic control in a scientific way. Instead of shutting down the hospitals in a one-size-fits-all manner, especially the emergency dialysis operation room and ICU, as well as the operation room for labor. They should definitely remain open. Information transparency is more important.
Any departments that have suspended their services, information must be released to the citizens via the WeChat, other social media, and on the screen of the hall in the hospitals. The earlier and the more detailed, the better. Third, for health institutions who do exist such risks and where the closure is necessary, there must be emergency response initiated to timely carry out environmental disinfection screening of the staff so that we can swiftly put a hospital on lockdown and can also equally swiftly remove or lift the lockdown. Information must be timely released to the citizens. Besides, we request the localities to have the solid efforts in emergency boosting up services, set up hotlines to provide convenience to the general public, receive their complaints, and provide them with timely response and solution to minimize the impact of the pandemic prevention control on the normal health needs of the general public, and see to it that their health needs are met. With CCTV, as has been mentioned, the pandemic situation is grim and complicated in the country. We've noticed that among the new confirmed infections, many have been screened because of community screening. Is it because we've removed the regulation and control measures on the contacts of close contacts? How can we ensure precise, targeted, and efficient control of the pandemic? Madam Hu Xia is taking the question. There is a high percentage of confirmed cases, confirmed infections out of community transmission. It is because of two reasons. First, the feature of the virus. We know the COVID-19 virus has been evolving rapidly. Omicron has been prevalent for over a year, evolving into more sublineages with its stealth transmission. If we fail to adequately implement the monitoring measures, we may identify a cluster at a later stage when there is already community transmission. Second, it is related to the response to the pandemic. If at the early stage of the outbreak, we can timely identify and control the community transmissions, accurately find the close contacts, and have timely zoning of the risk regions, we are taking advantage of an early intervention. If we hesitate and miss the important critical window of control, there will be a rapid surge of community transmission, adding to the difficulty of prevention control. As to how can we be more targeted and efficient in bringing the pandemic under control, first, we must have 4 earlies. Have regular monitoring, ongoing monitoring, enhance the sensitivity of monitoring, and step up the monitoring over people, health institutions, and population at risk, so as to ensure early detection and early management of people at risk. Second, we must consolidate the 4 parties' responsibilities, that is, the accountability of locality departments, organizations, and institutions. Unaffected localities, departments, and organizations should continue to refine and implement the ongoing regular control measures. And for the affected regions, emergency commando system must be initiated to galvanize all the efforts, act swiftly, unite all forces, and consolidate the social fabric of prevention control. Third, we must have 4 coordinated measures, that is, coordinate the forces for NAT testing, epidemiological survey, quarantine, and management of people on move. We must have well-coordinated uses of all these resources to forge synergy in prevention control. Thank you. Next question, please. Thank you. With Phoenix TV, according to the 20 measures for people working at high-risky posts, their closed-loop management has been adjusted from 7 days of mass quarantine plus 7 days of home quarantine to 5 days of home-based health monitoring. Is there a clear definition of posts at high risk? And during the 5 days of home-based health monitoring, are these people allowed to exit their community? What are the procedures needed? Madam Wang Yanping is taking the question. According to the 9th version of the Prevention Control Protocol, posts at high risk refer to people who are exposed to a higher risk of infection, including those who are contacting the inbound travelers, directly contacting the imported objects, particularly cold chain products and cargoes, and the cross-border transportation vehicle drivers, cleaning staff, maintenance, and the people moving the downloading and uploading of the port cargo, and those who are working at immigration or customs. Also for those who are working at the mass quarantine places and people working on the posts for designated hospitals or the fever clinics of the health institutions. So they are supposed to be put on closed-loop management, have a strict and rigorous management of NAT of their work, and have a rigorous NAT testing after the closed-loop management. When they take a break, they will be put on 5 days of home-based health monitoring. They are advised not to exit the community only when necessary. For example, seeking medical services, they need to apply to the community. Once approved, they are advised to have good personal protection, wearing N95 mask. They are advised not to go to crowded public places and not to take public transportation vehicles. With the Guangming Daily, 20 members put forward that the hospital staff infection response plan must be developed. The town hall training for the health professionals must be carried out. 3 years in the fight against the pandemic, what are the changes of a hospital-acquired infection prevention control? What is the infection rate? Madam Guan Yanhong is taking the question. National Health Commission attaches great importance to the prevention control of hospital-acquired infection. We've been improving our control mechanism to effectively prevent and control hospital-acquired infection since the outbreak of the pandemic. In light of the evolution and the transmission features of the virus, we've been timely optimizing and improving the working mechanism and technical guidelines for preventing hospital-acquired infection. At present, as the evolution and the spreading of the virus are accelerating, in particular given the fact that some localities have suffered from community transmission, the hospital-acquired infection prevention control efforts are meeting more arduous challenges. We must step up our efforts to mitigate and prevent hospital-acquired infection with a focus in the following aspects. First, we must pay great attention to the efforts and shouldn't take any chance. As the health administrator, we from the National Health Commission will continue to improve the monitoring of the health sector and provide technical guidance. Health institutions must implement all the working standards to maximize the efforts in mitigating and preventing hospital-acquired infections. Second, we must have reasonable arrangements of healthcare services and ensure appointment, staggering visits, optimization of the procedures, and give play to the role of Internet plus health services.
Measures have been adopted to rationalize, prioritize the patients, so there is no gathering of patients, especially in the emergency and outpatient. We should do everything we can to make appointment of the necessary treatment diagnosis so that we shall reduce the gathering of patients and reduce the infection among the patients. Also, we need to do a better job of individual prevention and protection, especially for respiratory infectious diseases. The healthcare providers should obviously engage in professional, technical prevention and protection. But for patients or those who accompany the patients, once they enter the premise of healthcare facilities, they should follow the protocol of wearing masks and should keep social distancing and safe distance so as to reduce the probability of cross-infections. Or fourthly, we should strengthen the administration of the hospitalization, inpatient regions, we shall reduce the unnecessary visit or accompanying of the families of the patients. So we shall reduce the probability of importing infection risks out of hospital into hospital, so as to prevent the infection of those who are hospitalized. And those are very important aspects. In addition, once there has been some detected positive cases in hospitals' healthcare facilities, we need to reduce and prevent the risks as soon as possible, and to obviate the need of locking down the hospitals. Even if there is the necessity of shutting down the hospital, we need to follow the principle of fast lockdown, fast screening, fast disinfection, and fast loosening up or lift the lockdowns, so that the healthcare service can be restored, especially for the emergency dialysis operation room, ICU, and the maternity and the newborn rooms. They shouldn't be shut down as much as possible, so that the healthcare needs may be protected. So next question. For the close contact, the measures for the close contact, previously it was 3-day home health quarantine. Home health monitoring now has been transformed or converted into 3-day home quarantine. What the reason for such adjustment? What will be the major differences, and what conditions should they conduct the home quarantine, and what are the aspects they need to pay attention to? Ms. Wang Libin, please answer the question. Thank you for the question. We made the adjustment based on our data of evaluating the implementation of the 9th edition of prevention control. We found that among the close contacts, the rate of testing positive within 5 days has reached 94.5% for the close contact, where if there's 7 days, the rate will be increased to 99.7%. So that we have reduced the 7-day centralized quarantine into 5 days of quarantine in centralized facility. And then for the subsequent risks, we have adopted 3-day home quarantine, so that we have strengthen the control for the subsequent 3 days. That way we can save the resources of centralized facility. Also, we can mitigate the risks and increase the efficiency of prevention control. For the differences for the home quarantine vis-a-vis the home health monitoring, because these two category of people, they carry different level of risks. For those who are under home quarantine, then they will be given the red code or health code, so that those who are under home quarantine and those who share the same home should not step out of the home. They should reject all visits. During the quarantine, then the community should organize the relevant staff to collect their sample by doing the COVID test for those who are under home quarantine. If they do have the need of seeking healthcare services, then the special vehicle should be arranged and the necessary individual protection should be enforced. So we have the closed loop management. For those who are under healthcare monitoring, during that period of monitor, they shouldn't step out of their home without absolute necessity. Also, if they need to see a doctor or for some other circumstances, they need to conduct self-protection and need to wear a 95 mask. Also need to avoid using the public transportation vehicles. But those who share the same home with them are not subject to such restrictions. As to who shall be subject to home isolation, well, firstly, they need to live alone on their own, or within the same apartment. There's a separate, highly ventilated room, which shall serve as a quarantine room, which should be relatively separate from other rooms. There must be the chairs and stools outside the quarantine room, so that the necessary goods can be transported, can be conveyed to this person in a non-contact way. Also, this person shall try his or her best to use a separate bathroom, so that he will not share the bathroom with other family members. Also, if there is a air conditioning system, I shouldn't use the centralized air conditioner. You should use the separate air conditioner, so there's no closed-loop air. Also, in the room, the necessary equipment such as the napkin, a mask, and the disposable gloves and disinfections and other protection stuff should be used, as well as the dustbin with the lid, as well as the temperature. Also, what are the matters this person should pay attention to during the home quarantine? Again, we need to emphasize that the person under home quarantine, as well as the who share the same home, must make sure they should stay at home. They shouldn't step out of the house. Also, when there's an absolute need, the special vehicle should be arranged. Also, they need to conduct a daily health monitor and report the result to the community who conduct the health observation. Or thirdly, those who are under home quarantine should have the self or individual protection. Again, they need to carry out their daily life within the separate isolated room. The family member shouldn't get into the quarantine room. If the person under home quarantine is a mother or doing the breastfeeding, then she can continue feeding the baby and the premise of doing the best job of individual protection. Well, fourthly, the ventilation should be guaranteed within the room. He or she should refrain from sharing the daily necessity stuff from the family members, as well as obviously doing the COVID test. Thank you. Next question. The journalist on the third row to the right, the lady. Thank you, Mr. Moderator. I'm from Shenzhen TV. I noticed that we already have 20,000 confirmed cases, among which 100 are severe cases. There's a view that if you look at the mortality as well as the severe cases rate, there's no need to increase the ICU beds. What's your take on that? Also, for the number of severe cases as well as number of the beds for the hospitalization, has the National Health Commission done the testing and put forward some metrics for the hospitals? Well, this has always been an important goal and indicators for us to increase the rate of treatment and lowering the mortality rate. Ever since the outbreak of COVID-19, those have always been our goals. Through the coordination of prevention and healthcare, we have coordinated all the different diagnosis and treatment resources, putting emphasis on both the traditional medicine and the modern Western medicine. We have been able to maintain the severe disease rate as well as the mortality rate at a very low level. It's certainly very necessary, important for us to increase our resources, especially the resources of treating the severe cases. Here are the reasons. Firstly, there is a major imbalance among different regions in terms of the healthcare resources. On the whole, we don't have a very sufficient healthcare resources. For example, we have 6.7 beds among 1,000 residents. Among 100,000 people, there are only less than 4 ICU beds. Therefore, on the whole, our healthcare resources should be expanded and should be improved in terms of the quality, and these should be deployed in a balanced way among different regions, especially for the ICU or for those resources able to treat severe cases. Well, secondly, as we know, the current Omicron variant is very super infectious. The spread speed is super fast. It's capable of reducing relatively large-scale pandemic in a short period of time. We've seen such a major increase of the outbreak of cases. We're obviously a large country with 1.4 billion people.
Equally, there is a greater number of people suffering from underlying diseases. The senior citizens and those who suffer underlying diseases are prone to develop into the severe or critical cases. Among the severe cases, we need to pay attention to 2 things. First, severe cases caused by COVID-19 virus. And second, there are also severe cases triggered by both the coronavirus and underlying diseases who need cross-disciplinary treatment. That's why we underpin the importance of the personnel and health professionals taking care of severe cases, in particular cross-disciplinary health workforce. That's why we've improved the service capacity for the severe case treatment. It is not only to battle the pandemic, it is also the long-term development and should be pursued throughout the further development of a healthcare sector. We need to have the preparation of a health workforce to treat severe cases for both normal time and emergencies. In the future, we'll press ahead with stable efforts, continuously improve the quality healthcare and have a regional balanced distribution of these healthcare services to provide quality and efficient health services to the general public and safeguard their life and health. As the journalist has mentioned, now in the country there are over 100 severe cases. This is a testimony to the threat brought by COVID-19 on the elderly and those suffer from the underlying diseases. We are proactive in our prevention and control to minimize infection with a view to reducing the number of severe cases and bring down the fatality. Prevention remains the utmost instrumental tool. Some say it is not necessary to increase the beds for critical cases. That position cannot stand. It is important for us to have well-coordinated increase of both hospital beds and beds for critical cases. Thank you. Last question for the day. With Southern Metropolitan News, in the previous press conference, it was put forward specifically that in local prevention control measures, we should say no to over-regulation of lockdowns and inaction of letting go. But still, these two fallacy tendencies still exist. What are the measures adopted to correct the wrongful practice? I'd like to invite Madam Hu Xiang to take the last question. Thank you for your question. To see to it that localities will implement prevention control measures in an uncompromised manner, recently, Interagency Task Force convened national televised conferences to explain the 20 optimization measures. We've also convened national work training to elaborate on the keys for implementation of the 20 optimization measures. We've convened many televised and video-linked conferences to provide further emphasis and make arrangements for the prevention control in different localities with a focus on the most hardly hit provinces. We've sent different work teams and contingents to different provinces to guide their local prevention control to better guide localities to follow the 9th version of prevention control protocol and 20 optimization measures. Shortly before, on the 19th of November, Interagency Task Force General Office issued several technical documents, including the NAT testing implementation measures, the measures for risk zoning and risk region management, guidelines on medical observation for people on home quarantine, and guidelines for the health monitoring for home quarantine. To provide convenience to community workers to better understand and implement the 20 optimization measures, going ahead, we will continue to provide training on the implementation of the 4 technical guidelines. We will continue to step up the efforts of the ad hoc working committee to correct wrongful practices of imposition of arbitrary restrictions. We should say no to both over-regulation and inaction. Yes, indeed, we say no to over-regulation or inaction. Again, I'd like to thank all the panelists for the information on how we can implement the 20 optimization measures in an uncompromised manner. We'll continue to hold future press conferences. Please stay tuned. I conclude today's press conference. I thank you.